welcome and good evening. August 15th, 2025. Ask Your Herb Doctor, KMUD 91.1 FM. From 7 till 8 o'clock, the show's running. It's a live stream broadcast, and from 7:30 to the end of the show, 8 o'clock, you're invited to call in with any questions. The number 707-923-3911. So, my name's Andrew Murray.
My name's Sarah Johannesson Murray. Welcome to this evening.
We're both licensed medical herbalists who consult with clients with a wide range of conditions, and our website is westernbotanicalmedicine.com. You can also visit our site to see a list of our organic medicinal herb tinctures, and our contact details are there also. Alternatively, we can be reached on our toll-free number, which is 1-888-WBM-HERB, and our Western Botanical Medicine Twitter's account handle is at WBM-HERB. Sorry. And links to both our Twitter and YouTube channel are also on our website at westernbotanicalmedicine.com. So, excuse me, August 15th, 2025. We're going to carry on. Last month, July, we kind of finished up the Forever Chemical two-month kind of topic, and the beginning of last month, or half of last month or so, was the beginning introduction here into male health. I'd already said, I think probably 80% or 70% of clients that I see are female. Don't seem to see a lot of men. And I think some part of that is this kind of, taking care of yourself and not, toughing it out and not being too fragile about things, right? And so we don't really take care of our hair and our nails and our skin and, all this kind of stuff. And by the same vein, I think men generally aren't too concerned about their health, which is kind of, it's kind of sad, really, because there's plenty that can be done to maintain a man's virility. And that's what I want to get into as part of tonight's topic. It's a pretty big topic, and there's quite a few herbs that are used for male health. So there's plenty of different conditions that men suffer with, and it's not just increasingly getting older and fatter and more worn out and less male. But obviously the dominant male hormones that give a guy his characteristics of, gruff voice, beard, muscle building, his kind of drive, stamina, etc., all part and parcel of his physiology. And as you get older, if you're not careful and you don't consider these things, you are by virtue going to become less male as your environment gradually takes a bigger toll on your health. So we've spent plenty of time in the last 20 years talking about environmental toxins, and Dr. Pete was a favorite on the shows. We discussed plenty of subjects, from microplastics to estrogen mimics and endocrine disruptors. So whether it's in the air we breathe, or the water we drink, or the food that we eat and the conditions under which it's grown, the practices of modern agriculture and our modern way of life have exposed us more so than ever to an overwhelming variety of chemicals that in very, very small concentrations significantly impact our health. I've mentioned many times that the kind of scales that are used for estrogen or progesterone, when they're measured in the blood, are nanogram and picogram per mil concentration. So these are 10 to the minus 9 and 10 to the minus 12. So they're incredibly small amounts, but they have amazingly big effects downstream in the physiology of the person, whether it's male or female. So to say that these environmental agents are not such a big deal because we can carry on living, that's one thing. But we carry on living in a very poor way until we die. And that's definitely part and parcel of not paying as much attention to our health as we could, and the things that we could avoid doing that would prolong our life, and not just prolong it for the sake of dragging it out, but actually have a more virile and more stamina-filled life. So whether it's eating and eating too much and eating the wrong food and becoming obese, or whether it's drinking too much beer and the estrogenic effects from the hops, or whether it's not paying attention to the food that you're eating and how you're detoxing, whether you're working out or working and exercising, or just working physically and sweating as a means to increase your detoxification, or whether you like to pay attention to those things that are supportive to the liver. So obviously, we mentioned many herbs that are liver supportives. These things will promote the clearance of estrogen. Dr. Pete was a big advocate of raw carrots. Sounds absolutely simple, and you might want to brush it off, but in terms of a insoluble fiber that will pass through your bowel, ultimately unchanged, it has the effect of removing excess waste from your bowel, including estrogen. So all of these different strategies that can be instituted can certainly make a difference to your health. So tonight we're going to talk about male herbs and male health and virility. There's many different aspects to male health, whether it's physical strength and musculature, or whether it's virility from a fertile perspective, in terms of male sperm count and sperm virility. Obviously, there's been plenty of discussion about the decreasing birth rate and decreasing fertility, both amongst men and women, contributing to the lower populations that are being produced than ever before. And obviously, plenty of countries around the world are looking at a stark reality in terms of the birth rate is not significantly high enough to maintain or grow a population. And so there are certain countries in the world where it's a really big deal. What can you do about it? You can't just suddenly plant an extra 5 or 10% of the people in a country there to support it because the country is not producing enough children, unless of course you have mass migration, which does happen, but not going to get into it at this point. So the conversation this evening is about male herbs. So last month I kind of mentioned two herbs. One essentially was nettle root, and the other was tribulus, both in the seeds of tribulus and the foliar part of the tribulus plant. They have slightly differing phytochemicals that have slightly different physiological effects downstream, but I wanted just to re-go over both nettle and tribulus, and then we're going to get into all of the other herbs, things like uricoma and yohimbe bark. There's probably more than enough for this month, and probably we'll run into next month with it. But it's a pretty interesting subject in terms of the wealth of herbs that are there that can have this effect and really make a difference physiologically to a man's health. Okay, so Urtica dioica, the common stinging nettle, particularly in this case the root and not the herb. The herb is more of an anti-allergic for asthma and that kind of situation, but the root specifically contains phytochemicals that are aromatase inhibitors, and we'll get into the ins and outs of aromatase blocking and how that's initiated, and the modern day aromatase inhibitors that are used for breast cancer, particularly for females, exemestane and anastrozole and letrozole, and how some of these herbs that have aromatase blocking activity stack up against it. So stinging nettle root then traditionally been used to address urinary symptoms, particularly those associated with benign prostatic hyperplasia. Now, men that have enlarged prostates and a diagnosis of benign prostatic hyperplasia know all too well the effects, and I would say that they are very disabling. When somebody has to get up 3, 4 or 5 times a night to urinate because they don't void fully because the prostate is squeezing on the urethra and allowing or not allowing complete emptying. And it's not just during the nighttime, obviously it continues during the daytime too. So when the prostate swells, obviously the urethra passes through the prostate gland. So this swelling has its effect of squeezing the urethra as it passes through that tube that empties urine from the bladder out through the penis. And when that's cut off or squeezed, and the circulation decreases, somebody has to have frequent urination of small amounts, and it's just a big drag. I mean, fortunately, I don't suffer from it, but I've met plenty of people who do. So it's no joke. Obviously, the other sequelae in some people, but not all, obviously, is prostate cancer. It's definitely on the rise, and I'd say again that the environmental contaminants and the environmental burden certainly have increased this over the last 50 years compared to previous history. So the aromatase inhibition is one part of nettle root's activity. So when testosterone is produced, it can be converted to estradiol. So in the presence of active thyroid hormone and a good metabolism, it's not. It is directed into the steroids. The steroids are not converted to estradiol, and a man has a good, healthy testosterone. If you take someone's blood and you measure their testosterone for a young man of 20 and 30 with a good muscular physique, the testosterone could be 800 or 900. So as you get older, a 70-year-old man probably has a testosterone of about 350. And testosterone is directly related to not only physical physique and male drive, but also to fertility and sperm count. So with the aromatase inhibition that does come from using nettle root, the main phytochemicals are secoisolariceresinol, also an oleanolic and ursolic acid, and a 14-octocosanol. They've been identified as having this moderate aromatase inhibitory activity. So by inhibiting aromatase, stinging nettle root extracts can potentially reduce the conversion of testosterone to estrogen. We're going to get into the subject of DHT and whether DHT is better than testosterone, and Dr. Pete's viewpoint on this differs quite significantly from this traditional medical model. So if you're searching for information, you're more than likely going to get the medical model of prostate disease, where it's counterintuitive to suggest that DHT would be better. But obviously the medical model does differ from Dr. Pete's understanding of benign prostatic hypertrophy and indeed hormone physiology. But I'm going to get into the two differences as we get on through the program. The other activity of nettle root is a sex hormone binding globulin modulation. So SHBG, as you might see it if you look in the literature. Particularly the lignans that nettle root contains can bind to sex hormone binding globulin, a protein that binds to sex hormones, including testosterone. So when testosterone is bound to this molecule SHBG, it becomes inactive, meaning it cannot exert its biological effects. So if you can decrease SHBG, you have more free testosterone. So by interfering with the binding of testosterone to SHBG, stinging nettle root may lead to an increase in the level of free unbound testosterone in the body, which is a form available for the body's tissues. So in summary, stinging nettle root's phytochemicals may potentially block the conversion of testosterone to estradiol by inhibiting aromatase enzyme and modulating sex hormone binding globulin, thereby increasing the amount of free testosterone available in the body. You're listening to Ask Your Herb Doctor, KMUD Garberville, 91.1 FM. From 7:30 till the end of the show at 8 o'clock, you're invited to call in with questions on this month's subject of male health. And the number is 707 923 3911.
So I wanted you to talk a little bit about how nettle root can also help women because it's an aromatase inhibitor and how that helps women with lowering estrogen.
Yeah. Okay. Well, I mentioned initially the pharmaceutical aromatase inhibitors are pretty well known for women that have breast cancer or are recovering. Letrozole, anastrozole, and exemestane are the three main aromatase inhibitors. So these work again exactly the same way as I've mentioned the lignans and other phytochemicals in nettle root by blocking the conversion of androgens to estradiol. So for a female, if he's blocking the conversion of these, this is basically for estrogen dependent tumors. So they categorize cancers by their receptor types. So they can be estrogen positive or estrogen negative, etc. And they have other markers of hormone positivity or negativity associated with the germ or the cell line of each cancer. So by blocking aromatase for an estrogen dependent tumor, then you are going to prevent the increased proliferation and increased production of tumor in that particular area, that gland or whatever that organ is that has that tumor.
And also, drugs like letrozole are used in fertility clinics to suppress excess estrogen in infertile patients because too much estrogen will make you infertile. And so nettle root can be used the same way in females who are having difficulty ovulating because of polycystic ovaries and also high estrogen levels or estradiol levels. And you can do a blood test for that where you look at your estradiol and your progesterone ratio to see if it's high enough to support fertility. Well, that's something that needs to be about a 1 to 50. So you need to have 1 part estrogen to 50 parts progesterone. And conditions like polycystic ovaries, it's very common to see like a 1 to 10 or a 1 to 15 ratio of estrogen to progesterone. Or, if it gets below 1 to 5, then you can have serious high estrogen
seizures,
things like epilepsy, epileptic seizures, etc.
Okay, so the pharmaceutical industry have those 3 main aromatase inhibitors that are used commonly to treat cancers by blocking the enzyme aromatase. There are other, obviously, and we're going to go through the different herbs, some of which have either testosterone enhancing effects or aromatase blocking effects to increase testosterone directly by preventing the conversion to estradiol. But there are other key phytochemicals with potent aromatase inhibiting activity, some of which I won't be going into detail with, but let's just quickly go through some of the plants and the groups of compounds that are known to have aromatase inhibiting activity. So flavonoids, flavones, and isoflavones, then these diverse group of plant compounds, abundant, not surprisingly, in various fruits and vegetables like citrus, grapes, apples, etc., have shown aromatase inhibiting properties, and examples include quercetin, luteolin, apigenin, genistin, naringenin, which is a big favourite of Dr. Pete's, and chrysin, which I will talk about in a little more detail here from passion flower. And then there's resveratrol. People have probably heard a lot about resveratrol in the last, 6-7 years. It's become fairly popular, probably more than that even, but it's found in grapes and red wine. So resveratrol is another phytochemical that's been investigated for its aromatase inhibiting capabilities, and most people that have thought about health and have looked at any of the research or read around the subject will have recognized that grapes and particularly red wine has certainly been shown in plenty of studies to improve health and also to be cancer fighting, so mainly due to the resveratrol content. And then everyone's heard of turmeric, but the main compound in turmeric, at least the one that it's standardized to, not that I believe in standardization to any one particular phytochemical as being the reason that the plant does what it does or why it has the activity it's used for, but curcumin present in turmeric extract Also a well-known antioxidant and anti-inflammatory, has shown some potential in inhibiting aromatase. And then the cruciferous vegetables, the cross bearers, if you look at the flower, it's got a distinct cross as a pattern. So vegetables like broccoli, cauliflower, Brussels sprouts, and cabbage all contain this product, indole-3-carbinol and sulfarane, which have also been shown to have potential aromatase blocking activity. And then, because we were talking about isoflavones, the phytoestrogens, another class of molecule. So these compounds and the phytoestrogens, similar in structure to estrogen, can also interfere with estrogen signaling and may inhibit aromatase activity or gene expression. So they can sit in the receptor, but they don't elicit the same response as estrogen does, so they basically occupy it and prevent estrogen from docking itself. Okay, so that's basically some other plant-based aromatase inhibitors, but I'm going to carry on with the individual herbs. And I remember last month I was talking about Tribulus terrestris. And again, it's just a case in point that there are plenty of phytochemicals that have a long shelf life. And so whilst all of our products, we kind of self-limit all of our products to a 3-year expiration from manufacture, there are plenty of different phytochemicals that have 5 and 10-year life, before they become subpotent. And just a case in point that the furanol saponins from Tribulus terrestris was something I brought up last month, but I couldn't quite remember the manufacturer. So I had some tablets. I don't quite know how I got them. I don't have low testosterone. I got pretty high testosterone. So I had these tablets from a Bulgarian pharmaceutical company called Sopharma, and that was the name I was trying to remember. And the product was called Tribestan.
Oh, no, remember, I bought those
Oh, you
because I
bought
was
them.
testing. We were working with the USDA lab in Berkeley, and we were testing the Tribulus terrestris from resting in the river versus
right.
the Bulgarian packaged product.
All right, so you were the one who brought them into the store. Okay, so anyway, what I was going to say was I remember just going through the cupboard. You have all these different things that you use over all this different time, and I came across these tablets, and they were foils. So I popped one of these tablets. I just thought I'll just have one anyway, just because I was rummaging through the cupboard, and incredibly strong tasting still. It's just like Tribulus terrestris. So when you work with herbs, you get a feel for them. I've been working with herbs for nearly 30 years, so I'm pretty familiar. I won't say that my sense of smell is the best. I defer to you for that, Sarah, because she's got an incredible sense of smell. So whilst I'm not analytically very accurate, unlike you, I can certainly taste, which is strange because smell and taste generally go hand in hand, but I could taste
Well, you
rather
can
the,
smell. It's just you don't have like overly active and overly acute sense of smell like I do.
Dr. Pete would also say that your smell is down to estrogen, perhaps. But anyway, that's another story.
Well, yes, I am female.
Okay. So anyway, so these Tribestan tablets are incredibly potent tasting still, just like I remember Tribulus. So I make an extract of both Tribulus fruits and Tribulus leaf. And they both have very slightly different activities. And anyway, so Sopharma, Tribestan was the name of the product. They still sell it. And it seems for some reason that Bulgarian Tribulus has become a benchmark. I'm not too sure why, but it's a widespread weed in Southern America. So whether it's Texas or New Mexico, Arizona, it's one of those scrubby weeds that really tolerates drought quite easily. So anyway, just to quickly go through the leaf and the seeds of Tribulus before we get into all the other herbs that I want to talk about for their testosterone enhancing effect for people with androgen deficiency, with gonadal dysfunction, or fertility issues, or they just can't build muscle, or they've got male breasts, or any of these things that plague guys if they don't know what's going on. There's plenty that can be done. So Tribulus terrestris, and commonly called puncture vine, the seeds or the calyx of this is extremely thorny. And they will totally puncture bike tires. So the leaves essentially there's more of a testosterone increasing effect in the leaves than the fruits. For libido's sake, there's a strong libido enhancing effect in the leaves, and not so much so in the seeds and the fruits. For males with erectile dysfunction, the leaves don't have such a good effect as the seeds and the fruits do. Very strong support for the seeds and the fruits. For sperm motility and morphology, there's better evidence to support improved both motility and morphology in sperm production from the seeds and the fruits. And then you have things like nitric oxide and cyclic GMP, which are more strongly affected by the fruits. And then there's LH, obviously with dysfunction. LH and FSH can be problems on blood work with a male with low testosterone, high prolactin, for example. LH stimulation is more pronounced in the leaves than the seeds and the fruits, and for prolactin suppression also, the leaves have more of a pronounced effect. So for a patient perhaps who's got low testosterone and low LH, the leaves could certainly be used as part of a multifunctional approach to the treatment. Somebody with normal testosterone but poor libido or erectile dysfunction, the seeds and the fruits have a better indication. And then things like the benign prostatic hyperplasia or frequent urination, again the seeds and the fruits. And then estrogen dominance in a male, both the leaves in conjunction with aromatase inhibitors like nettle or chrysin would certainly be indicated. Okay, so that's Tribulus terrestris. I'm probably going to interject here and there as we go on with other details. There's lots and lots of research and lots of data surrounding it, but it is coming up to 7:30 now, so the lines will be open from 7:30 till 8 o'clock. You're invited to call in with questions. My name's Andrew Mai. This is KMUD Garberville 91.1 FM, and this is Ask Your Herb Doctor.
My name's Sarah Johannesson Murray. Thank you for joining us.
So the number's 707-923-3911. Okay, so let's jump into something I was going to start on last month. I want to carry on this month with both Eurycoma, Yohimbe bark. Going to be taking a look at that. Another quick look at the breakdown of Tribulus terrestris fruits versus leaves. Turnera diffusa, I want to look at that. The Damiana root. Mucuna pruriens, a very interesting herb with a good dopa content, used also for Parkinson's, but certainly in the context of high prolactin could certainly be useful. And then plenty of other information, again, saw palmetto, nettle root. And then I want to go through all of the different scenarios that people might come up against, and then talk about Dr. Pete's rationale and how it differs from the mainstream medical model, and to help people try and understand that, you know, a lot of things you've heard is just not always the way it is. So I think we've got a caller on the air. So let's take this first caller. Caller, you're on the air. Where are you from, and what's your question?
I'm here in Humboldt, and I just wanted to ask you a question that I was asked by a coworker. He was basically getting ready to have his, I forget what the procedure is, where you basically tie off the sperm ducts or whatever.
Okay.
But basically, he, I think, had been told by his dad perhaps that it affects maybe either your sex drive or whatever it is. I mean, he was kind of awkward about it. So I just wanted to ask the question if you know if there's any association associated with, you know, basically making it so you're not getting women pregnant anymore.
Right.
Yes, there definitely is plenty of research that indicates that vasectomies can decrease male fertility and cause impotence.
Okay. Yeah, I wondered if, I mean, it's hard to say exactly. Do you know the underlying reasons for that? Is there any research kind of talk of looking at that?
Yeah, I mean, you could do a PubMed search, but Dr. Pete was suggesting when I said, well, why does that happen, when I asked him about that, and because I know clients that have had vasectomies, and in the long run, I mean, it doesn't happen immediately, but as you age, it gets It's more prevalent
Okay.
in men that have had vasectomies. And Dr. Pete's rationale behind it was that when you have any type of surgery or interference in an area, it creates an inflammation. So that was one reason why he thought it was affecting it, just a general inflammation. But he also went into more detail about why it's not good and why you should not be doing that, especially if you're worried about impotence.
Okay, awesome. All right, I'll let you get back to the show. Thank you very much.
Okay, you're welcome. So the number's 707-923-3911. From now until the top of the hour, we'll be taking questions about this month's subject of male health, specifically related to testosterone production, how we can increase our testosterone even as we age. We don't have to become weak, flaccid blobs. We don't have to become fat, and we don't have to become weak. We can definitely get older and not as strong, but we don't have to have low testosterone as we get older. It's a kind of myth. Anyway, so the next herb I want to cover, a common name is called Tonkat alley or Eurycoma longifolia. Now, it stimulates the Leydig cell within the testes. There's both the Sertoli cells and Leydig cells. And the Leydig cells produce testosterone. The Sertoli cells are kind of involved in sperm maturation and kind of quality. So it stimulates the Leydig cells and increases luteinizing hormone. It reduces sex hormone binding globulin that I've already mentioned, and that sex hormone binding globulin, if it binds to sex hormones like testosterone, it's going to lower them. So it inhibits and reduces sex hormone binding globulin, and it suppresses the hypothalamic pituitary axis. So this entire axis is responsible for the stimulation, output, feedback, and control regulation of pituitary hormones, of which these LH, FSH, etc., react and initiate, the kind of sex drive that men and women, both appreciate. So they call this commonly an HPA axis, but it's a hypothalamic pituitary axis. So between the hypothalamus, the pituitary, they feed back to each other according to levels in the blood, and they will either increase or decrease the output of various hormones. From a reproductive perspective, Tonkat alley has definitely increases sperm count and motility. It increases libido and erection, so it has a direct effect on erectile dysfunction. So as males get older, and again, I don't think it has to, I don't know about it myself for sure, but I would think as men get older, they don't need to have erectile dysfunction. I truly believe that there's plenty of things that you can do, both physiologically, physically, and within your diet and lifestyle, that would prevent you from getting erectile dysfunction. And I see that as being a consequence of decreased energy, especially related to estrogen increasing in males, that robs males of their energy, interferes with hormone physiology, and the lack of male hormones and the increase of female hormones in the male is what's responsible for the entire erectile dysfunction. So basically with testicular steroidogenesis, this particular herb works that way. It increases nitric oxide. Now I know Dr. Pete's not a big fan of nitric oxide. I'm not saying I am, but I'm just saying that there's definite research to suggest that nitric oxide increase is part and parcel of the way that vascular increase blood flow, both to the corpus in the penis, is another way of increasing erection. Okay, it also increases and supports dopamine production. It's been termed loosely an adaptogen, so it restores the hypothalamic pituitary axis, improves mood, and reduces anxiety. By way of its being an anabolic agent, it enhances the kind of androgenic tone in muscle tone, and improving creatine uptake and protein synthesis. It works as an anti-inflammatory by decreasing both tumor necrosis factor and the interleukins and C-reactive proteins. So this modulating these nuclear factor kappa beta pathways and COX-2 pathways is a anti-inflammatory approach. It's antioxidant. Again, I mentioned that it protects the Leydig cells and testes from oxidative stress, and that in its own right will improve sperm quality. It's been given some anti-cancer possibilities in terms of the research that's been done. It is cytotoxic to some cancer cell lines, and it contains quasinoids like uricomanone, and these have anti-proliferative effects. And then, as a side note, it has an antimicrobial effect against malaria, of all things, and has an antibacterial effect. So it's been shown to have an activity against the plasmodium that causes malaria and E. coli. So that's Uricoma longifolia. It boosts testosterone, basically increasing total and free testosterone in men, particularly if levels are low or borderline. Now, the mechanisms by which it's been associated with having this testosterone boosting effect is by stimulating luteinizing hormone release, and it promotes Leydig cell testosterone production. So as I mentioned, the Leydig cells are involved in testosterone production, and the Sertoli cells, both of which make up the architecture of the testes, the Leydig cells the Sertoli cells are the cells that are involved in maturation of sperm quality, etc. So Tonkat Ali inhibits aromatase activity modestly. It's not as strong perhaps as nettle root, but it does reduce sex hormone binding globulin, therefore allowing for more free testosterone. So if you're going to use this, you could use this in conjunction with an aromatase inhibitor, so you get a twofold effect. One would be to increase your free testosterone by binding sex hormone binding globulin, and then you would also block aromatase activity from allowing any testosterone to be, or less testosterone to be converted into estradiol. The other effect it has indirectly by blocking the conversion of testosterone to estradiol is that it works to lower cortisol. And I mentioned the hypothalamic pituitary axis being related to stress, and a lot of males that would have this kind of HPA axis and stress will have high cortisol. So these herbs would also lower cortisol and improve someone's anti-inflammatory activity. So it improves the testosterone to cortisol ratio, and it acts via modulating the adrenocorticotropic hormone and adrenal axis, especially useful in overtrained athletes. Funnily enough, these people, whilst they may be high performance, there's a lot of stress, physiological stress associated with it. And these individuals tend to be under what would be termed a kind of chronic stress. They may be living with it, coping with it, and winning medals, etc., but it's definitely a very stressful physiology. So it's been shown to improve sperm parameters, as I mentioned, basically the sperm concentration, the motility, viability, and the volume. And also it improves the testicular function by decreasing these kind of oxidative stress products, so reactive oxygen species and that kind of compounds that promote inflammation. Plenty of clinical highlights, plenty of research papers done, plenty of information on PubMed. You can look at Tonkat Ali from a research perspective and find hundreds of papers supporting its use. So basically the key benefits would be as a testosterone booster, then especially in borderline or low testosterone, it modulates prolactin indirectly via dopamine and cortisol, and we'll get into mucuna pruriens hopefully. If we don't do it this month, we'll do it next month as a dopamine agonist. And it works as an adaptogen by reducing cortisol and stress-induced suppression of androgens. It enhances libido, as I mentioned. It increases energy, fertility, and anabolic status, so it's pretty good for athletes, for muscle building, etc. And it has low estrogenic risk, and it may slightly inhibit aromatase. It's not a big aromatase blocker. Okay, so for the sake of mentioning those companies that want to standardize to a particular compound or produce high potency, and labeling their products a highly high potent product and charging 5 times as much for it. The uricomanone content is what has been highlighted as being main ingredient, but I would always say that if you can get the whole herb, whole plant tincture, that would be my choice. So
there's just so many different compounds, medicinal compounds and herbs, and when you isolate and synthesize one specific compound, you could be missing out on the protective effects of another compound that was also present in the herb matter. So it's really important to use the whole herb. If you want to concentrate it, fine. That's what we do with decoctions and teas and tinctures, and sometimes even tablets. If it can handle heat, you can make a tincture that does a very wide spectrum extraction, and then you can reduce it under a vacuum so you don't heat it up too much to make a sticky resin, and you can put that in a tablet. But generally speaking, you want the herb in its whole form so that you don't start isolating chemicals and making a drug out of it. Because when you make a drug out of something, then you have side effects. And that is so common. The common example I like to use of that is furosemide. It's a diuretic that's been around forever. They actually figured it out because it's a chemical that's in dandelion leaf. And dandelion leaf works just like furosemide. It's just much, much weaker. You can make it really strong, but when people are given furosemide as a diuretic, they have to be given potassium alongside it because it causes a huge loss of potassium when you use that drug, that diuretic drug. Well, naturally occurring in dandelion leaf is very, very high levels of potassium. So when you use dandelion leaf as your diuretic, and you can make it really, really strong, it's obviously a bitter tasting tea, but then you have all that potassium with it, so it's self-protective, and it's still just as effective in high enough doses as a drug.
Okay, so the next herb I wanted to talk about is yohimbe bark. People that are well versed in herbs have probably heard of yohimbe. Pausinis stalia yohimbe. But we'll catch this right after this next caller. Caller, you're on the air. Where are you from? What's your question?
John, and I'm from local here. I lost my sense of taste post-COVID.
Mm-hmm.
My sense of smell is pretty good, but I did lose my sense of taste. And so I've been on a protocol of nicotine intake mildly. I haven't smoked in 40, 50 years, but I was advised to try and use a nicotine gum is what I'm using now to see if I can regain a sense of taste. Have you heard anything about that? And I'll take my answer off the air. Thanks.
Okay, thank you. I have not heard of it in direct relation to restoring a sense of taste, but I do know that research is being done. A lot of research actually is being done on the effects of nicotine, the medicinal effects of nicotine on protecting the nerves and the nervous system. Mm-hmm. And so, when you lose your sense of taste and smell post-viral infections, whether it was COVID or another coronavirus you had 10 years ago before we knew about SARS-CoV-2, or they created SARS-CoV-2, shall I say, it damages your nerves. That's what happens. The virus gets into your nerves and that damages them, but it doesn't have to be forever. So other things that are helpful are anti-inflammatories like Baikal skullcap. That's a really good post-viral herbal tincture to use to help decrease inflammation, because basically virus causes a lot of inflammation in the nervous system when you lose your sense of taste and smell. And aspirin is also helpful and useful, and as long as you make sure you take your vitamin K too if you're using aspirin, since aspirin is a drug, and then you have to take a supplement to protect yourself from the effects of the drug. Things that are anti-inflammatory are very helpful in restoring the taste of the sense of taste and smell. Sorry, there's another caller on the line here. And it totally is possible for your taste and your smell to come back post-viral.
Okay, so we'll take the next caller. Caller, you're on the air. Where from? What's your question?
Hi, this is Lori Berkeley. My question is about progesterone. I've heard that there are progesterone-positive breast cancers, and I don't understand that because I know progesterone can be help with estrogen dominance, and I wondered if you could make a comment about that. And then the second part is, do you know practitioners with a repeat kind of perspective that work with cancer patients.
Right. So.
Okay, so I'll answer the question about.
I'll take it off.
Sure.
Okay.
I'll hang up.
Thank
Okay.
you. Thank you for your call and your question. So, breast tissue has estrogen and progesterone receptors in it. That's just how breast tissue is made. And this is how Dr. P explained it to me when I asked him the same question about how can you have some cancers that are progesterone receptor positive, as they call them. And Dr. Pete's response was, if I'm quoting him correctly, was that it's very hard to separate the breast tissue that has cancer in it from being estrogen or progesterone dominant, because in studies they show that progesterone is so anti-estrogen, and estrogen has been shown to be the cancer promoter. He said he thinks it's just a misunderstanding of the cellular tissue that's an overactive dividing and dividing out of control, and that it really is the estrogen that stimulates the breast cancer cell. And yes, there are progesterone cells, receptors, in breast tissue, and you just can't really separate the two because they're so close together. And we're talking about, like Andrew was saying, in picograms and nanograms, the amount of hormone in the cells and the receptor. So I think it's this whole receptor physiology that we've been taught is
It's a bit contrived.
Yeah, it's really, cells are very fluid and things come in and out of cells, and they actually created this whole receptor theory in order to market pharmaceuticals. So there's a lot of physiology and scientists who say that it's not so cut and dry. You have one drug, it hits the receptor, and boom, it has an effect. Yes, there are some instances like that, but I think it's an overgeneralization of physiology for the ease of marketing, and a pharmaceutical company manufacturing their science, their pseudoscience behind why something works and why it doesn't. That we've already seen that with serotonin drugs. They said, SSRI, selective serotonin reuptake inhibitors, they actually increase serotonin. Well, actually now they're saying we don't really know if it increases the serotonin. It might actually block it, because serotonin is an inflammatory hormone. It is not an anti-inflammatory hormone. So they're not sure how that works, but they thought that was a great idea to market an antidepressant drug and call serotonin the happy hormone and the sunshine hormone, and however they wanted to call it with their serotonin receptors. But now they're saying, well, it doesn't really interact with the serotonin receptor like we thought.
Okay, I think to answer your second question as carefully as possible, I've probably spent the last 30 years practicing herbal medicine. I've seen a lot of different people with a lot of different conditions, and whilst even in England with my license, you're quote-unquote not allowed to treat cancer, but all of the side effects that come with cancer and all of the reasons that cancer may form and all of the protocol and strategies to mitigate what would normally be termed cancerous or cancer promoting, certainly have an understanding of all of that. So whilst I'll never treat cancer, I have a pretty good understanding of physiology and phytochemistry in terms of giving someone the best possible advice going forward to how they can mitigate their exposure. Okay, so the number, if you're in the area, is 707-923-3911. From now until 8 o'clock, you're invited to call in with questions. The subject here is testosterone enhancing anabolic herbs for male health, and whether it be older men with decreasing testosterone or younger men wanting to improve their testosterone or their physique in terms of their muscle, or whatever it is around health for males. It's pretty much grounded in good hormone production, and obviously from the perspective of Dr. Pete's rationale, who we kind of grew up in after we fledged from the academic, regular, mainstream medicine model. there are plenty of other substances that are very important in terms of thyroid or progesterone, pregnenolone, DHEA, vitamin E, vitamin D, plenty of other neuroprotective compounds that work together to enhance someone's health. So you don't have to just get old and die, and you can get older and feel better rather than feeling worse and worse. So anyway, we're going to carry on. Talked about yohimbe bark very briefly. The active compound, for quote-unquote sake of being the compound that is responsible for the effect, yohimbine. It's an alpha-2 adrenergic antagonist, so it increases sympathetic nervous system activity and can enhance libido and erectile function. It may increase noradrenaline, some stimulating the hypothalamic pituitary gonadal axis indirectly, and for its effect on prolactin, it may lower prolactin through dopaminergic and adrenergic mechanisms. From a point of view of its testosterone effects, there's mixed evidence to show that it can slightly increase testosterone, but primarily supports erectile function and libido through other mechanisms. So there's more than one way of approaching any problem. So from a perspective of vascular improvement for blood flow, for psychogenic effects, for adrenal supportive effects, these are all things that can work together for the good of the effect we're looking for. Okay, it's probably, I should probably put the caveat for patients that have got cardiac abnormalities or cardiovascular risk or high blood pressure or anxiety prone, these people that are running more on adrenaline. It's probably not the herb that you'd want to use, because it does have that kind of stimulating effect, and it can exacerbate symptoms if there's already a high sympathetic tone in the person. But it is a useful adjunct in cases where low libido or erectile dysfunction and high prolactin are present, but it's not a direct testosterone booster. Okay, so Tribulus terrestris fruits, and quickly talk about that again. The compounds protodiosine and the saponins, pheostanolsaponins, that increase libido, spermatogenesis, and support testosterone production directly by supporting Leydig cell function in the testes. As I said, it does have some ability to decrease prolactin levels in males, possibly via a dopaminergic pathway. And this is where also Mucuna pruriens, which I'll hopefully get time to talk about, or maybe I won't, it's 6 minutes to the hour, and I wanted to talk about Turnera diffusa afterwards, so probably next month we're going to cover more of Turnera diffusa, which is Damiana, well-known quote-unquote aphrodisiac, how it works physiologically and the phytochemicals responsible. Then we'll get into Mucuna pruriens, all of its dopaminergic effects, its neuroprotective effects, obviously its anti-Parkinsonian activity, and how the pharmacokinetics work to elicit the response from Mucuna. I go back over again Urtica dioica radix in its aromatization, anti-aromatization, and then look at Serenoa, saw palmetto from a 5-alpha reductase inhibition activity, but then talk about how the mainstream medical model looks at benign prostatic hypertrophy and testosterone in males, and how Dr. Pete's rationale was very supportive of DHT. So unfortunately, DHT is really not that easy to get. There's very few places. I don't think it's even produced in the States anymore. I think you have to go out of the US to get Andractim gel, for example, which is one of the main trade names for DHT in terms of a gel. And then, so basically go through Dr. Pete's rationale versus the mainstream. And
yeah, the DHT is completely banned in this country. It's like very, very regulated. And in Belgium, they treat men for andropause, as you want to call it, and they use Andractim, which is DHT, to help those symptoms. But we can discuss that in more detail next month.
Yeah. Okay. We will go over other supplements, things like P5P, vitamin B6, Vitus agonist castis, look at L-theanine and tyrosine, and look at some of those other agents, obviously things like thyroid and progesterone, vitamin E. Obviously, these are all things that Dr. Pete was very passionate about. And then, things, methylene blue and those kind of things. But anyway, we've gotten up to and including, we finished him being, and I was wanting to get to Turner diffuser, but we may not, who knows. Okay, so it's 4 minutes to the top of the hour. Okay. So Turner diffuser then, we'll quickly get into that, and I think that's probably where we'll have to stop it, have to make a note of this is where we got to. But Turner then, Damiana root, Turner diffuser, it's kind of African shrub. I can't say too much in 3 minutes, can I? Otherwise we're going to get into the next hour. So anyway, next month we're going to carry on male herbs. So guys, don't forget, there's plenty that you can do. If you think you're starting to lose it and that's just a function of age, forget it. It's not. It doesn't have to be that way at all. Don't let that be your mindset. There's definitely lots of things that can be done to improve your anabolic mass, your muscle mass, your steroid hormone production, your masculinity, for the sake of being virile and male and being able to work. That's what we're supposed to be doing, working by the sweat of our brow, right? Okay, so at that point, there's plenty of herbs and plenty of dietary advice, plenty of lifestyle changes that can be made so that you can enjoy a good, healthy life right into your 70s, 80s and beyond, as far as I'm concerned. You don't have to crash out when you're 50. Anyway, so it's 2 minutes to the top of the hour. This is Ask Your Herb Doctor, KMUD 91.1 FM. My name's Andrew Murray.
My name's Sarah Johannesson Murray. Thank you for joining us this evening.
Until September of next month, you've been listening to Ask Your Herb Doctor, KMUD Garberville. The Tonight Show was a discussion of male herbs, and next month's discussion, September, will be the same. Carry on. My name's Andrew Murray.
My name's Sarah Johannesson Murray.
We're both licensed medical herbalists, and we see a wide range of clients with a wide range of conditions, and it's our pleasure to be doing what we do.
Our show has been live streaming on YouTube tonight. I think it was successful, so you can access the show there or on KMUD Audio Archives. Thank you for listening.
This program is copyrighted. All rights are reserved. Reproduction in whole or in part without the express prior written consent of the owner